Hello, everyone. It's Friday, February the 5th. As we go through the people that we've lost, we are now up to 2,100 deaths in West Virginia. We've lost an additional 42 people. Our numbers are showing some level of improvement, but it's just hard to sit here and think about improvement when we've lost 42 people. But we're going to keep on, trying with all in us to get through this, and we're going to get through it. But we've all got to know this is some tough stuff. And as I go through these people that have passed away, one of them I'm going to read is, I think, a 24-year-old, and it's just tragic. That's all there is to it. But our 2,059th death is a 75-year-old female from Marion County. Our 2,060th death is an 87-year-old male from Wyoming County. Our 2,061st death is a 72-year-old female from McDowell County. Our 2,062nd death is a 95-year-old female from Mingo County. Our 2,063rd death, an 81-year-old male from Putnam County. Our 2,064th death, an 88-year-old female from Putnam County. Our 2,065th death, a 76-year-old female from Cabell County. Our 2,066th death, a 72-year-old male from Wyoming County. Our 2,067th death, an 87-year-old male from Mason County. Our 2,068th death, an 81-year-old male from McDowell County. Our 2,069th death, a 59-year-old female from Monongahela County. Our 2,070th death, a 75-year-old male from Mineral County. Our 2,071st death, an 87-year-old male from Brooke County. Our 2,072nd death, an 85-year-old male from Berkeley County. Our 2,073rd death, an 87-year-old male from Mingo County. Our 2,074th death, a 59-year-old female from McDowell County. Our 2,075th death, an 83-year-old female from Brooke County. Our 2,076th death, a 92-year-old female from Wood County. Our 2077th death, a 57-year-old male from Mingo County. Our 2078th death, a 70-year-old male from Grant County. Our 2079th death, a 96-year-old female from Wyoming County. Our 2080th death, a 71-year-old male from Nicholas County. Our 2081st death, a 60-year-old male from Mason County. Our 2082nd death, an 83-year-old male from Wood County. Our 2083rd death, a 77-year-old male from Raleigh County. Our 2084th death, a 71-year-old female from Ohio County. Our 2085th death, a 92-year-old female from Harrison County. And get this. Our 2086th death, a 24-year-old male from Berkeley County. Our 2087th death, a 49-year-old male from Ohio County. Our 2088th death, a 59-year-old female from Harrison County. Our 2089th death, a 72-year-old male from Cabell County. Our 2090th death, an 89-year-old male from Berkeley County. Our 2091st death, a 94-year-old female from Hancock County. Our 2092nd death, a 71-year-old female from Ritchie County. Our 2093rd death, a 73-year-old male from Hardy County. Our 2094th death, an 88-year-old female from Mercer County. Our 2095th death, a 66-year-old male from Mason County. Our 2096th death, a 79-year-old male from Raleigh County. Our 2097th death, a 79-year-old female from Mingo County. This is not a misprint, but our 2098th death is an 86-year-old female from Putnam County. And our 2099th death is another 86-year-old female from Putnam County. Our 2,100th death in West Virginia is a 71-year-old female from Grant County. 2,100 great West Virginians. Ooh-wee, man, oh man. Please, 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 please keep them in your thoughts and your prayers. Don't let them become a number. I mean, do you really have any idea how we just go through life and we worry and things are tough in lots of ways, but for these families, they're grieving, so be with them. We have 597 new positive cases in the last 24 hours. That's encouraging. That's a little better. That's a significantly better number. Our daily positivity rate is at 4.26. It hadn't been that low for a good little while, I don't think. Our cumulative rate has ticked down from 5.62 to 5.61. We have 17,761 active cases in West Virginia. That number continues to fall, and that's great, great stuff. The number of daily active cases in West Virginia has now gone down 20 straight days, and that's really good. Our recovered cases are a little over 103,000, almost 104,000. I always go to the graph, you know, but if you'll go to the graph and look, the top line, the light blue line is recovered cases, and the dark blue line on the top graph is active cases, and it just gets wider and wider, and that's exactly what we want it to do. We're down to 384 hospitalized patients, you know, in West Virginia. That's wonderful from COVID. We have 116 still in the ICU units, and we just hope and pray that all these people will get through this, and we really, really are always concerned. We have 8 counties in West Virginia that are red right now, and we're very hopeful that we're going to get all those out of the red as soon as we possibly can. I remind you again, if you're 65 years of age and you have a sniffle, you have a headache, you're tired, you're just anxious, go get tested. It's free, it's painless almost. Absolutely, you will have the results. And if by chance you were to happen to have this dreaded killer, we'll absolutely stop it in its tracks. With our antibodies, we'll try every way in the world to get you those. We'll get them to you and everything, but we're very, very optimistic that that will stop this thing if we can catch it early enough. Our vaccine distribution update is this week. We're still doing that incredible work as far as our vaccine administration rates. For last week, we were at 108.1% on the administration rate of our first doses and 70%, right at it, of our second doses. This week, with the balance of Saturday and Sunday still in front of us, we are already at 99.1% of first doses and 73.2% of second doses. In just the last 24 hours in West Virginia, and I think about this, and this is great stuff, we have administered 15,088 vaccines to people in the state of West Virginia in the last 24 hours. Our goal is to get 100% of shots into arms every week, and we're doing just that in all 55 counties this week in our Operation Save Our Wisdom. To date, West Virginia has administered a total of almost 300,000 vaccines, 294,059. That's amazing. It's great stuff, great work. We continue to lead the nation. We're the envy of the nation in so many ways. It's good stuff. It's good, good, good stuff. As far as our vaccine scheduling system, you know, all West Virginians that are age 16 and above can pre-register. We encourage everybody to pre-register like crazy and everything. Monday, a week ago, we launched this program. We've gotten just a little over 200,000 West Virginians have now pre-registered, and I encourage them to continue to pre-register. You will not lose your spot on a wait list or in line. if you pre-register. Absolutely, it will just help in every way. And we're trying to look after all the different demographics and everybody in just every way you possibly can. And if you still are struggling to try to figure out how to register online, call us, and we'll help you through the process. In our Saving Our Wisdom clinics, we held clinics, or we are either holding or we've already held clinics in all 55 counties, and we're working towards, continuing to do that. We're vaccinating people that are 65 years of age and older. You can check your website for your local health department for any changes that have been announced due to weather or things like that. Residents from any county can go, across county lines to clinics and everything. And we've got to remind everybody we do not have enough doses to vaccinate all West Virginians at this time, but we're working it and we're pushing them as hard as we possibly can. So far, there has been 100,286 individuals in excess of 65 years of age or, and that have absolutely gotten their shots. And there are 34,288 that have their second shots in their arms. I go back to this over and over and over and over and just say the same thing. We pivoted, did we not? And we moved towards testing our elderly. And if you don't buy it from me, just turn on the national news and let them tell you. But nevertheless, in doing so, instead of waiting until April to get to these people, we have now put shots in people's arms, 65 years of age and older, 100,286 people, and 34,288 on second round doses. Now let's just step back and just think. What if we had not done that and we had waited until April? How many of those people would we have potentially lost? It could have been an awful lot. So thanks so much to all the health departments, the National Guard, all the people that are making these licks happen. Thanks to all the experts. I could never thank you enough from the bottom of my heart. I apologize maybe for pushing awful hard, but at the same time, I'm not regretful of that because we've done good work, and I thank you so much. Our vaccine hotline is up there and everything. Vaccine reminders, you really need to take your vaccine. The percentage doesn't need to be 81% or 62% or whatever. It needs to be 100% or they're close to it, because really and truly the vaccines are proven to be safe, and the alternative is not good. It's just not good. You cannot go through and not have a vaccine in my book. If you do, you're taking a whale of a risk. Now, your stubbornness or people telling you you'll grow antlers or a third hand or whatever it may be, I'm telling you as straight up as it can be. If you listen to that nonsense or you're too stubborn to get that vaccine, this thing, if it jumps on you or a loved one, it's going to be bad. It's going to be really bad. And you need to listen to me. As far as our antibody treatment, I've told you about that. If you're 65 and above and everything and you get this, we can really stop it in its tracks by moving quickly. Take advantage of all of our testing spots. It's free. The map should be up here. Our drive-through pharmacies, we thank them and really appreciate all the great work they've done as well. We're down to 49 outbreaks in our long-term care facilities. That's wonderful. Our church community, I applaud you in every way. It's great work. There's only 3 active outbreaks in West Virginia right now in 3 counties. That's Clay, Fayette, and Summers County. It's great, great work. Please just continue to keep a pew in between you. Wear your mask, stay social distance, wash your hands, and more than anything, if you're 65 and older and everything, and you can just hold off just a little while and you can get your services online or whatever like that, maybe the thing to do. From corrections standpoint, what a job corrections has done. It's amazing beyond belief. I think we've lost 4 or 5, and I want to be accurate in everything. People in the entire corrections system. It is amazing to think how this has gone through other jails and places all across our land in this country. In West Virginia, it's down to 33 inmate cases and 28 staff. Great job, guys. Great, great job, and ladies. Face covering stuff, wear your mask, give blood. If God above has blessed you to pull through this, I'd think really, really hard about paying back and go give blood. There was some, I don't know if it's a miscommunication or discrepancies or whatever like that, but we did put out that we're going into session. We've got a lot of activities going on within the Capitol right now. We've got some, not a lot, but a good many people that are still working from home. If they can get the work done from home, more power to them. That's great stuff and everything. And our cabinet secretaries are monitoring all that. I don't know how we got upside down, in what we were asking people, but the bottom line is just this, everybody is back to work in lots of different places. However, we don't want people to come back if we can get the work done and we can service the public and do all of our jobs and keep the continuity of government going and everything. And so we're all on board from the standpoint of being super safe and trying to watch. However, if our cabinet secretaries deem that we need you back because of just all the things that I just outlined and everything like that, we need you back, but that I hope that clarified everything, but we still want to be as safe as possible, and if we can get the work done from home, that's good too. Our school lunch program today, I'm announcing that there will be a second round of pandemic electronic benefit transfer program funding allocated to eligible children who qualify for free or reduced lunch price or reduced price school meals during the COVID pandemic. The program will continue to be administered through the West Virginia Department of Ed and the West Virginia Department of Health and Human Services. The funding has already resulted in more than $72 million in food assistance support for West Virginia's children, and an estimated $200 million is expected as part of the next round of benefits. Benefits will start to be released by mid-March and will be applied retroactively, to the beginning of the school year. Families will receive the new electronic benefits cards in the mail. We are incredibly grateful that another round of these benefits will be allocated to West Virginia, even as the challenges posed by the pandemic continue. Our children are the greatest treasure in West Virginia, and making sure that all of our kids have enough is absolutely the most important thing we can do. It's why the moment we closed our schools last year, we went right to work delivering over 1 million meals all across the state. So we appreciate the extra help in this program, and we'll continue to provide and look after our kids. This is interesting, but we received a letter, I guess yesterday, from a Minnesota state senator. And the state senator's name was Michelle Benson. And yesterday, when we received this letter, it was a letter basically thanking our team, and it is a big team of a lot of people in my office, our experts, all the health community, the National Guard, all the different people, thanking our team for leading the way and they are requesting our advice on how to improve vaccine distribution in Minnesota. The letter reads, West Virginia has been a leader in distributing vaccines in a safe, transparent, and effective manner. Minnesota would have great value in learning from you and your administration about how your state has been one of the most successful at getting COVID vaccine to those who need it the most. And it goes on to say, in Minnesota, we have faced a myriad of problems, as here or anywhere, with our vaccine rollout. leading to confusion and frustration that we have not had here. To many, many Minnesotians, clearly our state leaders have something to learn from your administration, not just my administration. You know, all states have a ton to learn from all the goodness that's going on all across the state. All across the state. This is not about me or my administration alone, by any stretch of the imagination. You know, West Virginia, you have been so spectacular to all of us stay together. We've all pulled the rope, have we not? And really and truly, I could never be any more proud of you. You know, and so it goes on to end up by saying, I wish to invite you or someone from your administration to provide virtual testimony in our committee in the near future to talk about why West Virginia has been so successful in distributing the COVID vaccine. And we are absolutely happy to help. We will be responding to the letter today, offering up our experts or whomever that can help them, myself or anyone that can help them in any way, because the bottom line that I have said 1,000 million times is, you know, an American in Minnesota, an American in West Virginia, an American in Texas or New York or Los Angeles, really and truly, we're all just that. We're not West Virginians. We're not Republicans or Democrats, or we're not black or white or rich or poor. We're all in this together. We're Americans. And absolutely any way and every way we can help, we're going to help. So I'm really proud of you, and we're going to help some people, and you know, who knows, we may very well be calling on them to help us someday. So thank you so much. That's all I've got for right now.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, thank you and good afternoon. Following up what the governor said, I think that this united purpose that we share here is something that is really important for the rest of the country as well. And I give the governor a tremendous amount of credit for helping our state pull the rope together. But it's really heartwarming to hear that we are all starting to gather as Americans and help each other out, share any information that would be useful for anybody else, and learn from everybody else. That's really what has made America great up to this point, and it's what we need to do to help move through the COVID pandemic in the best way possible. To reinforce what the governor said about the Everbridge program, please register. Even if you had registered before at the county level, go ahead and re-register. As the governor said, you won't lose your place in line. The only caveat is that we do have our priority schemes, and as the governor has instructed us, that our primary priority is to save lives and improve well-being, as well as maintain capacity and function of healthcare and communities. So within that priority, you won't lose your place in line, but we will prioritize the people that are the highest risk of dying and having severe complications from COVID-19. So as we look at the future, you know, as the governor said, West Virginia has done amazing. Our citizenry has been, you know, incredible in your ability to care for each other, you know, to understand what services and altruism is. The Johnson & Johnson vaccine is now undergoing emergency use authorization application at the Food and Drug Administration. We anticipate, based on at least what we've seen so far, that this will go forward, and that is really important because that will give us another vaccine to include in our armamentarium that we can use to try to protect people. And as we look at the data from all the vaccines, it is very apparent, at least to us, that the reduction in the number of deaths, and as the governor said, one death is too many, and He read a lot of names today as he reads the names of every West Virginia that dies every press briefing that we have. But overall, we have seen close to a 40 to 45% reduction in death from December to January. And we've seen an over 50% reduction in the number of people with COVID-19 in hospitals, which we do believe is directly related to the aggressive vaccination that we've done in West Virginia, and also the strategy. Because remember, our average age of somebody dying in West Virginia of COVID-19 is 77 years old. 77.5% of people are over 70. 92% are over 60, 97% are over 50, and half have resulted from nursing home residents. So by vaccinating this really vulnerable and critically susceptible population to severe disease and death, I think that we really do, as a state, work to protect our wisdom and also to save lives of our citizens, and also then be able to facilitate and maintain that hospital capacity, because these are also the people that end up in hospital beds, so that we can continue to serve all of the needs of our West Virginia citizens. And I think that although, you read in the papers and on the news, there are variant viruses out there, we know that this pandemic is not over yet. But I also joined the governor in really celebrating the greatness of the people of this state. And I think that, with external media sources being very interested in what's going on here, they're just figuring out what we've all known for so long, that the greatness of our state is really the greatness of our people, and the ability to work together, pull the rope in the same direction, all run to the fire by choosing to get vaccinated, by wearing your mask, by taking care of yourself, taking care of your neighbors, taking care of your family. That is the secret to West Virginia's success. And we know that no matter how much attention we get externally, that we need to keep our eyes on the real job at hand, which is to save lives, protect the well-being of our citizens, and have West Virginia thrive through this and be the beacon that everybody else can follow. So thank you so much.
Thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good afternoon. Just want to highlight two things today. I was asked by two national reporters this week, what has West Virginia done different? And my response was, our governor early on established a joint interagency task force with a set of priorities and gave us a focus. And that interagency task force focuses on coordination, synchronization, and communication across the whole of West Virginia. And it focuses our energy on specific efforts. We know we have a population that we must get at quickly, and it also limits and mitigates challenges that we have. And that the governor continues to tell us and the leadership team that we're in a race. As Clay points out, we're in a race to vaccinate those who have the greatest chance of dying and the greatest chance of being hospitalized. We also are in a race to vaccinate as many people as possible before the variants come to West Virginia and take hold here. So again, reinforce the value of that interagency task force and the decisions that the governor made early on related to that. In addition, I want to again highlight what both Governor Justice and Dr. Marsh have said, and that is pre-register. Pre-registering helps us plan, it helps us identify populations, and we will continue to navigate lists and coordination of lists across the registration system until we have a single focused list capability going forward. I appreciate all the work that everyone is doing and the great work that West Virginians are doing, and I thank you all as we go forward.
Thank you, sir. Dr. Inamjad, our State Health Officer, is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. I was wondering if anyone could give us any more information about the minority community clinics. I know we talked about it last week. We still didn't have all the specifics finalized about how many shots there'd be at each one and, who could go where. Thank you.
General, if you could give us that, please.
Yes, sir. Charles, actually, a group of individuals from the Minority Task Force, as well as an initiative led by Reverend Patterson, met with the Interagency Task Force yesterday. They will be rolling out those specific opportunities starting next week for our minority groups, and I will make sure that that our team gets you updated information on that. Don't have the specifics in front of me right now.
All right, thank you, Charles. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Governor, as you noted, the Capitol is going to be busy starting next week with the return of the legislature, kicking off with your State of the State address. A couple things I wonder, since the beginning of the pandemic, my understanding is the Capitol has largely been closed to the public, that you can enter if you have an appointment or a particular business, but otherwise the recommendation is to stay out. Do you think that status may change as the public's business is discussed during the legislative session? And really, I'm trying to still envision how your State of the State address may be. So many people crowded into that House chamber. I wonder if there will be any changes to it this year. Thank you.
Well, definitely, Brad, there's changes. I have kind of left that, to the House in the Senate because really it's the House's chamber, and so. They're taking every precaution. I think as far as the number of visitors, they're very, very limited. As far as how we're going to be able to spread out and everything in there, we're not going to be in a situation to where we're going to be crowded and whatever. And Capitol access is going to, the other part of your question is the Capitol access is going to be absolutely limited to just those that are here for official business with the legislature or with other government services. But nevertheless, I hope that answers your question. As far as the State of the State, trust me, I will promise you that it'll be right, and we'll be spread out, and we've got to go on with our lives and everything, but at the same time, we don't want to go on at the risk of compounding an issue that's a terrible problem like we already have.
All right, thank you, Brad. Next to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. I have some housekeeping things to take care of, some very short questions, but questions have been posed to me that I don't know the answers and hope to get them from you guys. One, I asked in November about the $4 million in extracurricular money, which will be going to West Virginia schools, and we haven't heard much since then. Governor, can you tell these people when those funds will be released? On a similar vein, a lot of fairs and festivals vendors are starting to book their events this year. The ones in the spring are still up in the air. Some of these things are non-refundable. Can you give some direction on that? And one medical question that Dr. Amjad might be able to answer. Once people get both vaccine doses as required, do their bodies then produce the antibodies needed to give blood to help others who have COVID? Thank you very much.
Okay, Kenny, I don't know exactly, where the 4 million, or I think it's like 3.4 or 3.6 million, to basically replenish the athletic departments on the dollars that they've lost and all that stuff. I don't know exactly where that is. I'll check with the Department of Ed and everything, but that was absolutely authorized and it should have already gone out. As far as our fairs and festivals, well, I mean, if I always say judge me by my deeds, and if you'll just look back at what we did last year with our fairs and festivals, we doubled down. I mean, not only did we give them their reimbursement and everything, we turned right around and gave it to them again and everything, in trying to help out in every way we possibly could. I'm very hopeful that this thing will will really turn, and will turn on a dime, you know, from the standpoint, you know, from the standpoint of this terrible COVID situation. And I hope that the vaccine, or our vaccinating of our people, will really turn this thing. Wouldn't it be great? Wouldn't it be just unbelievable, you know, if we could be back at our fairs and festivals and back to a way of life that even if we were having to wear a mask or whatever like that, it still really would feel good and be an awfully good thing. You know, from the standpoint that, you know, the funds, I had our people here just double check, but the funds have been given to the Department of Education, and I'm sure if those aren't out yet, that they're in the process of getting those out and getting them out very soon. From the standpoint of the vaccine stuff and taking both the vaccines, Dr. Amjad or somebody on our end is going to have to answer that, not me.
So the question about donating after you've gotten the vaccine, I'm going to say no, and then I'll let Clay assist me with that. But the question would be no, because you're getting the vaccine so that you can build up antibodies when you come across COVID-19. So you're prepping your body, you're priming your body so you come across COVID-19. We ask for people to donate plasma who've already had COVID-19 because they've already been exposed to that, to donate it. So that people who are getting the vaccine right now, they're only going to have antibodies really if they come across, you know, COVID-19. So we would not be asking people who got the vaccine to go and donate. Is that correct, Clay? Am I explaining that correctly?
Yeah, and I think that that's perfect. I mean, what we have the monoclonal antibodies, which are really, as Dr. Amjad said, the solution that is available for people who have an acute infection to reduce their susceptibility to get really sick with it. The convalescent plasma that the governor asks all the time for people to donate, really is made up of much more than just antibodies. It's made up of a lot of other immune factors, as Dr. Amjad said, in people that have gotten over COVID. So the reason why we use that in hospitalized people is because it is an assist in many different ways in addition to just antibodies, which we'd see much more with the vaccine.
All right, thank you, Kenny. Next, we'll go to Phil Gabler with the Charleston Gazette-Mail.
Hello, everyone. Given the remarkable progress we're making, leading the nation or close to the top in vaccinating seniors 65 and over, percentage-wise, we're still only about 30% of that population that's had a first vaccination, and about 9% that's had the second. And it looks like the issue is not getting enough doses in each week. What are we doing to increase the delivery of the vaccine?
Well, Phil, you know, other than me just running up there and sitting on somebody, we're doing everything. It's coming from all fronts. You know, I'm talking directly to the White House and directly to the Jeff Zients and all the people there. You know, our people are talking through our FEMA coordinators, and we're going through every channel we can go. Good thing is just this, you know, is we're going to get, you know, a bump in our vaccines. And it's, you know, if you think about, you know, we'd like to have it at 125,000 minimum a week, you know, and we're at 24,000, but we're going to 30,000 or right there at it. And that is better. And you know, and if we just step back and think about it, if we pick up another 6,500 doses, that's a lot of people. And but it's not nowhere close to what we want it to be. But hopefully Johnson & Johnson will come online, and or others, and hopefully this will be something that'll be as short-lived as it, you know, that we can hope in every way that it could possibly be. But we need vaccines, and Phil, we're trying. We're writing letters, and our congressmen are pushing and trying to help. But the problem that you got going on right now is the one thing that I cannot get in my head straight, and that is just this. You have states all across this country that have hundreds of thousands and or millions of vaccines that are not in somebody's arms, they're in a warehouse. Well, I have said until I'm blue-green, and you've heard me say that before, but I have said hours means something, not days, weeks, or months. Hours means something to trying to save somebody's life. How in the world could our nation post a number that says 52 million have been sent out and 32 million are in somebody's arm? Well, for God's sakes, a living, it doesn't take a rocket scientist to do the math there. There's 20 million vaccines in our nation right now. Now, we'd like them to make more, but there's 20 million in our nation today that aren't in somebody's arm. And our president stands up every day and says, we're now at 1.3 million a day. Well, if there's 20 million in the warehouse, it's going to take 14 days or some number like that, maybe even longer than that, probably more like 17 days, to just exhaust what's in a warehouse. And people are dying. I mean, that's all there is to it. Everywhere. I think we recorded the highest number today in our nation, period, that we've had. Over 5,000 deaths in a day. Now, to me, somebody do the math. Somebody just figure this out that says just what we did early on when we sent vaccines to all kinds of different pharmacies, and then we had too many in one place and not enough in another place. We went and got them. Well, I know that the demand for the vaccine now has grown, and people have finally figured it out. Think about the CDC coming out and saying, we think it'd be a good idea to deal with the local pharmacies. That's the ultimate comment for West Virginia, but for crying out loud, how long did it take? The net of the whole thing is just this. To me, we really have got to have a few million. It may not be 20 million because of second round doses and stuff like that, but it's millions of doses that are sitting somewhere in a warehouse. And I just can't break through on the fact that we ought to be going and getting some of those vaccines and moving them around the chessboard to people that are out of vaccines or people that are absolutely good at what we're doing. There's none better than our health people and our National Guard and all the great people that are doing this in West Virginia. There's none better. None better. That's all there is to it. And so we're pushing it, Phil. We're pushing it as hard as we can.
All right, thanks, Phil. Next, we'll go to Mark Curtis with Nexstar Media.
Yeah, and I'd like to ask a follow-up question to Phil's because let's just assume the FDA approves the Johnson & Johnson vaccine today. How soon would that be in the pipeline, and do we have any approximation of how many doses West Virginia would be getting weekly once it's approved?
Now, that's way over my head. General, maybe you can answer, or Clay. I do not know the answer to that.
I'll cover the logistics part, and I'll let my good friend cover the medical part, Governor. Right now, Mark, we do not have any indication based on what we know at this point how many J&J shots we would get. It all depends on their production capability, and I'll turn it to Clay for the medical piece.
Yeah, thank you, Mark, for the question. So usually the assessment is several days to a week or so as the Food and Drug Administration review all of the root data that's generated through the clinical trial, with the anticipation that the Johnson & Johnson product will be given emergency use authorization from at least what we know. Then, as the general said, part of the allocation would really depend on the immediate availability of doses that are then available through the federal government to be sent to the states. But we are very optimistic about the results that we understand from that clinical trial, and particularly optimistic about the benefit of the Johnson & Johnson product, just like the Moderna and the Pfizer product, of being able to protect people against severe disease, meaning hospitalization and death. That is really important. So more to follow soon.
All right, thank you, Mark. Next, we'll go to June Leffler with West Virginia Public Broadcasting.
Hi, June Leffler here. So now that we are, 1 month into vaccination rollout, I'm wondering more about second doses. So first off, a listener was asking just what they need to know as far as getting their second dose. Basically, if they have not heard from their health department when to get it, should they be expecting that call the day before, the day of? And then kind of a follow-up to that is, as these second doses become more critical, we're giving more of them out. I'm just wondering why the first dose administration rate is like so high. It's above 100% at times. And the second dose is, not up to that par yet.
General, you're popular today.
Yes, sir, Governor. So yeah, June. So if you have received a first dose and you have worked that through the various clinical opportunities in your county, you should anticipate that you, with the rollout of the 55 county effort that we now have, you will receive a call from that entity within your county. As we continue to build out the Everbridge system within the broader state construct, over the next couple of weeks to a month, that will start to help us to do some of the scheduling that will go on. Your reference related to the second dose percentage rate being lower than the first dose percentage rate. Understand that there is more logistics behind it, the appointment process for the second dose, as well as the coordination that has to take place. So there's always going to be for the next couple of weeks, a lag. The other thing that I want to make sure folks understand is, if you remember early on in this, there was a period of time where we got a significant amount of Moderna doses that came in a 1 week period. So as that bubble shifts forward, we'll see a greater increase in the percentage rate of the second doses because of the time frame to administer. The GIADF also works significantly every day to manage to make sure that we have second doses available for those who need them. We'll have periodic bubbles that we'll have to work through, but we're still confident that we're on track to make sure we manage all that effectively.
All right, thank you, June. Next to Brendan Tierney with WSAZ.
Good afternoon, Brendan Tierney here with WSAZ News Channel 3. I have a question about the vaccine rollout and distribution at this point. A week or so into it, how is the 55 county vaccine clinic model going at this point, and how scalable is it? When we expect to get more vaccines, how many of those rural counties do we expect to eventually get larger amounts of this vaccine? Thank you.
General, how in the world is this? I know you're looking good today, but for crying out loud, every single question heading your way.
Popular today, Governor. So, Brendan, we think the 55 county rollout is going exceptionally well. We have put it in place, and Joe Peel and the team in the Interagency Task Force, again, we are confident, as the governor pointed out earlier, that we could take a minimum of 125,000 doses a week right now and effectively and efficiently put them in arms. So we'll continue to improve each week the way in which we put those out, but we're confident in the 55 county rollout. each week as we get more doses in, as the governor pointed out, we're going to see an increase next week. Each county will see greater growth in that. But again, I want to make sure we understand too that right now we are focused on getting doses to populations in our counties based on the percentage of people in that county over the age of 65, plus where we have those key facilities like hospitals, and we continue to have to grow doses into our long-term care and assisted living facilities as we have more people move from hospitals to those facilities, and a growth in the increase in the number of employees.
All right, thank you, Brendan. Next to David Beard with the Dominion Post.
Hi, Brad covered most of my question on the state of the state. So I want to ask one more detail regarding that as a follow-up, and then I have my other question. We had heard, and I can't imagine it would be correct, that masks might be optional for the state of the state. And so given what we've talked about here, I didn't think that could be correct, but if you could clarify that. And then my real question is, when the Johnson & Johnson vaccines come out, will you have a separate box on your dashboard for that, so the numbers are tracked separately from the 1 and 2 dose Pfizer and Moderna vaccines? Thanks.
David, I'll make it real simple on the mask optional. There's not a chance on this planet that's come from us, and you know, without putting these stakes in the ground, you know, the state of the state's probably going to be given by the governor, and the governor would tell you, you know, if you're in the Capitol building, if you don't have a mask on in the Capitol building, you know, you've got an issue, that's for sure. But nevertheless, you know, someone answer the second question, you know, on the medical team and everything. Please, General, I know you want to answer it, but don't do it right now.
Why don't you take this one?
All right, Governor. David, to answer your question, yes, most likely we'll have a third box for exactly what you stated, since Johnson & Johnson is 1 dose. We'll talk to Secretary Crouch about that. He really heads up our dashboard, but yes, that'll make sense to have 1 box on there. I don't know where we're going to fit it, but we'll probably stick 1 box on there somewhere for sure. No. Thanks.
All right, thanks, David. Next to Zach Shrivers with WTAP.
Hi, guys. I have a follow-up from Wednesday. Paul Mullen had asked about the Johnson & Johnson vaccine possibly having an option between the vaccines. I believe it was either Dr. Marsh or General Hoyer said that age, there was not going to be a choice, but age may play a role in how that vaccine is distributed. I was wondering if any more thought had been given to who gets the Johnson & Johnson vaccine once it's approved, and how you came to that conclusion, if you've come to it yet. Thanks.
All right, Clay, this is you.
Yeah, I think this is me. So thank you for the question. You know, we've recently talked to an official at the coronavirus task force level who is, you know, gave us insight about some of the thought process at the FDA. So we very well might get guidance over the Johnson & Johnson product. And of course, if we get guidance, we will follow that guidance, you know, to the level that, you know, that it does fit West Virginia and stays within the guidelines that CDC and FDA recommend. The issue with the Johnson & Johnson vaccine and with the Moderna and the Pfizer vaccines are that right now, as we've talked about, you know, ad nauseum, we have a shortage of vaccines. We know from all around the world, including what we're seeing in West Virginia, that the vaccinations are making a difference. They're making a difference not only here in West Virginia, but they're making a difference in parts of the world where there are the mutant virus strains as well. In Israel, which has the dominant form of the virus being the United Kingdom variant, the one that we're a bit worried about in the United States, the Pfizer vaccine has, with 1 shot, has reduced hospitalizations by 60% for people that are over 60 years old. And as we look at the data on the Johnson & Johnson vaccine, we also see that the Johnson & Johnson vaccine across the world seems to reduce the risk of severe disease substantially, as well as protect people from death. So as we target our population, which the governor has instructed us to do, save lives, improve well-being, we really have targeted our older population, which is something that we are really committed to continue to do within the ground rules that the Food and Drug Administration and the Centers for Disease Control give us. And so if we're able to push more doses of all of our vaccines toward this population, as well as our other prioritized groups, then we will absolutely recommend to the governor that's what we do, because I do believe that's the reason why we've seen fewer deaths and many, many fewer hospitalizations. But we will wait, like everybody else, for the guidance of the Food and Drug Administration and the Centers for Disease Control. But with no restrictions by the FDA or the CDC, then that's the reason why we would be very aggressive and committed to continue to immunize this population, of which we've immunized now over 100,000 of about 350,000 over 65-year-olds, because that's the way that we save West Virginians' lives. Thank you.
All right, thank you. Governor, I'll turn it back to you.
Well, first and foremost, just everyone, stay the course. Things are getting a little better. We still got a long ways to go. You know, it's sad beyond belief, the 42 people we've lost today and the 2,100 that we've lost total. Our color map and everything on our counties is getting better. You know, thanks to our teachers and service personnel and all those that are in school. And with all this and everything, I'd wish everyone, you know, a good weekend. I hope that you enjoy the Super Bowl, and really I go back to just this. It's tough enough, is it not? It's plain tough enough. The good Lord still gave you the ability to be optimistic and smile and to laugh. And so, you know, I deal with a lot of experts all the time on a lot of different things and everything, and but in a different area of expertise. You know, I gave you a prediction on the Super Bowl outcome, and I've got my little buddy here and everything, and this I've got to reveal the expert that has led me to this prediction, and she's right here with us right now. So come here, little baby dog. Okay, and here's how she did it. She said Tampa Bay. That's 1, 2, 3, 1. 31. And Kansas City, that's 20. Baby dog says, with her seal, Tampa Bay, 31, Kansas City, 20. She put her stamp and seal on the bottom and signed it, baby dog. So she's in charge. You don't need to watch the game. Just go bet on Tampa Bay. Anyway, thank y'all so much. God bless all of you.